Parkinsonism does not always mean Parkinson's disease. It is a clinical syndrome, bradykinesia or slowness of movement with rigidity or resting tremor. Once you recognize it, ask, is this typical Parkinson's disease or is there something plus? Parkinson-plus, or atypical Parkinsonism, means the disease involves more than the usual dopamine pathway. Other brain systems are affected early, causing warning signs, early falls, eye movement problems, BP or bladder symptoms, dementia, hallucinations, ataxia, or cortical signs. The first red flag is poor levodopa response. Typical Parkinson's disease usually improves clearly with levodopa. In Parkinson-plus, the response is often poor, partial, or short-lived. Rapid progression is another warning sign, especially if falls, swallowing difficulty, speech problems, autonomic symptoms, or cognitive changes appear early. PSP is the falls and eyes syndrome. The classic clue is early backward falls with difficulty looking down. Patients may also have slow, vertical eye movements, axial rigidity, and frontal dysfunction. Early falls plus impaired down gaze should suggest PSP. MSA is the autonomic failure syndrome. Autonomic means automatic body functions, BP, bladder control, sexual function, sweating, and breathing during sleep. Parkinsonism with early postural dizziness, urinary symptoms, erectile dysfunction, cerebellar ataxia, or stridor suggests MSA. DLB is where the mind comes early. Look for fluctuating attention, visual hallucinations, REM sleep behavior disorder, Parkinsonism, and sensitivity to antipsychotics. The 1-year rule, dementia before or within 1 year of Parkinsonism, suggests DLB. Dementia much later after established Parkinson's disease suggests Parkinson disease dementia. CBS is the one limb behaves differently syndrome. It is usually very asymmetric. One limb may become stiff, dystonic, apraxic, or feel foreign. Alien limb, cortical sensory loss, myoclonus, and asymmetry are key bedside clues. Before diagnosing Parkinson-plus, exclude mimics. Drug-induced, vascular, normal pressure hydrocephalus, essential or dystonic tremor, Wilson disease in young patients, and structural brain lesions. MRI can support the diagnosis, but the diagnosis is mainly clinical. Hummingbird sign in PSP or hot cross-bun sign in MSA can help, but never diagnose by one imaging sign alone. Final pearl. When Parkinsonism does not behave like typical Parkinson's disease, look for the plus signs. Early falls suggest PSP. Autonomic failure suggests MSA. Early hallucinations or dementia suggest DLB. Asymmetric cortical signs suggest CBS. Diagnose the bedside pattern, not one isolated feature.